Welcome to another episode of the CGC show on AATV. AATV is the voice of higher education in Africa. We are coming to you live from the headquarters of the Association of African Universities here in Accra, Ghana. My name is Adjoa Omie and I am your host. Today we will be talking about dentistry as a career. My guest is here in the studios. We will delve deeper. I'll introduce him and delve into the conversation shortly. The show is proudly brought to you by the Association of African Universities. You can join in the conversation by following us on our social media platforms at AU_TV on Twitter, Association of African Universities on Facebook and YouTube, and at AATV Official on Instagram. A big thank you going out to GD Makeover GH for my makeup and Akosia Collections GH for my outfit. I'll introduce my guest after the break. Stay tuned. Welcome back. If you just tuned in, you are watching the CGC show, and today we will be discussing dentistry as a career. My guest is in the person of Dr. Tabi Amankwa-Mensah. He is a dentist at the Kolebu Teaching Hospital here in Accra, Ghana. Welcome on the show, Dr. Tabi Amankwa-Mensah.
Thank you for having me, Adjoa.
How are you doing?
By God's grace. Yourself?
I'm doing great, thank you.
Awesome.
So we would just delve straight into the interview. I would like to know what influenced you into choosing dentistry as a career.
Well, as a young person going through junior high school, senior high school, once you have a solid background in mathematics and the sciences, there is this tendency for the people around you to push you toward becoming a medical doctor or an engineer. That's what you popularly see. But because of some contacts my dad and I had with some dentists in the past in the form of treatment, I always had this passion of going into health, all right, but focusing on a localized area where I can give my all.
Okay.
Yeah.
So basically that's how your journey started for you.
Exactly.
In this COVID era, how are you coping, making sure that you don't contract the virus at your workplace?
Right. Thank you for that one. I'm sure you saw a number of publications online putting dentists as one of the high-risk group, if not the highest, in terms of COVID. Because in our line of work, we tend to generate a lot of aerosol. What we mean by aerosol is saliva droplets and mixed with air that comes out of the mouth. We tend to generate a lot, and that is one of the means through which COVID is contracted. But for us, personal protective equipment, even before COVID, was a priority in our line of work because of the fluids we come into. So with COVID in place, we had to boost our PPEs, to say we had to add more face shields and then introduce something called an extractor, which is basically like a vacuum, but one that is dedicated towards sucking out aerosols as they are being generated.
Okay.
Yes. So with that, we've not seen a very large number of cases among myself and my colleagues, I would say.
Okay.
Yeah.
So how long have you been in the industry?
From the journey itself is a really long one. But in terms of practice, I've not really practiced for long.
Okay.
About a year. But the journey to becoming independent to practice, it's a really long one. So maybe we should go there instead. Yes. So the program itself is 6 years of tertiary education. The first part, where you do what we call the basic sciences. You go with your medical colleagues, the medics, and then do the basic courses to introduce to you the human body.
Yeah.
Because as a dentist, you will not be treating the mouth in isolation.
Okay.
You treat the person as a whole.
Oh.
So you do that for 3 years, and then you have a graduation. And then you go into medicine and surgery for another year before you start dentistry proper.
Okay.
For 2 years.
So you go through with the medical students?
Yes. So you'll be with the medical colleagues till 4th year.
4th year, okay.
Exactly.
Before you specialize.
Before you come to the subspecialty of dentistry.
Okay.
So it's 6 years. Then after the 6 years, you do 2 more years, which is called a housemanship.
Okay.
Where you learn under a higher person, but this time around you are practicing as a doctor. So you are paid and all, but you get to learn more advanced things and have more hands-on with patients.
Yeah.
And then that makes your total of 8 years, and then you become independent to practice.
So you can go as a medical student and then do dentistry, or you would have to...
That is the distinction. You see, once you are entering from level 100 in the university, you have to choose the side you belong to.
Okay.
So if you go in as a dental student, you're a dental student all the way through till you become a dentist. If you are done with medicine and you want to become a dentist, you still have to come back to school
to do the 6 years.
No, that will be about 3 or 4 years,
okay,
depending on where you are doing the program.
Okay.
Yes.
And it's not limited to just science students from, let's say, SHS.
Dentistry is limited as it stands now. It is limited, but I know there are plans for them to expand the scope. But as it stands now, you would have had to have a science background, either from the Ghanaian system or either British. You just need a very solid science background to gain admission to start a program.
Okay, so the person will have to read science at the secondary school.
Exactly.
And I would like to know if, let's say I do science and I do a science-related course in the university or at the tertiary. I don't do medicine, but maybe I read, let's say, nutrition.
Okay.
Can I branch to reading dentistry?
Okay. So that is one of the areas they are expanding to.
Okay.
Currently, there is an avenue like that for medicine, which we call the graduate entry program. And dentistry is also planning to expand so that people with science background, not just from high school, but also university, can also join into the program.
Okay.
Yes.
So I think that's quite an advantage if you can just move. You don't have to stress yourself with the whole 6 years.
Exactly.
You can, but that would take quite a long time, because if you have to do your normal degree program for like the 4 years, and you say you want to branch into reading dentistry, and it takes you about 3 to 4 years.
Exactly.
It means you've taken about 8 years to get to.
But the thing is, at the end of the day, you still, assuming you did nutrition, you're still a nutritionist.
Okay.
So you have
you get
an advantage.
Okay.
But I am a dentist. I'm solely a dentist. But you come in as a nutritionist and a dentist, maybe.
Okay.
Yes.
Let's come down to talking about the qualities of a student. If a student wants to become a dentist, what are some of the qualities that potential students who want to go to the School of Dentistry, what are some of the qualities they should possess before?
Okay. That's a good one. You know, as dentists, you are like any other apprentice, but you need a lot of manual dexterity. You need to be very good with your hands. You need to have very steady hands. That is not something you may have at the high school level, but the course trains you. But if you have that, that is the number one advantage, because everybody there would have a very good academic background.
Sure.
Before you get in, the system screens to get the best. So you would have a very good academic background, but having a very good manual dexterity and some artistic background helps.
You should.
Yes.
Personally, I mean, from your own experience, what skill do you think has really helped you in getting to where you are right now?
Mine has been attention to detail.
Okay.
The mouth is a very small place to work with. But apart from it being a very small place, it is one of the most crucial areas because it's the main portal of entry into the rest of the body. And it's close to the brain. And there is a lot of blood vessels that come into the mouth. So whatever you're doing, you need to be extra careful.
Okay.
It's either your patient is going to swallow something through what you are doing, or you are going to cut your patient and they will be bleeding, things like that. But if you are attentive to detail, because it's a small area, but you must see and see the bigger picture.
Yeah.
Being attentive to detail has been my precious and the main thing that keeps me going, because I want to make sure I get to the tiniest detail, to the bottom of it, and that helps with managing your patients. Yeah.
I see. And are there areas of specialization in this particular field?
You see,
Or it's already a specialized
I am actually happy that you're doing this show because people perceive dentistry as just one thing, dentistry. I'm going to clean my teeth. I'm going to pull out my teeth. That is all they perceive of dentistry. But dentistry is as broad as medicine.
Okay.
Even though it is a branch of medicine, but it's a broad field on its own. There are so many subspecialties, so many subspecialties that will also take a certain number of years for you to be qualified as one.
Do you mind sharing some of them?
For example, you can become a maxillofacial surgeon.
Okay.
You could become an orthodontist. You could become a pedodontist, an endodontist. You hear dentist, the dont part is teeth. So you could become a maxillofacial surgeon, an endodontist, a pedodontist, a periodontist. There are so many. A community dentist. There are so many. But what it comes down to is through your training, which area that you develop most interest in. So I personally am leaning a bit more towards maxillofacial surgery. What maxillofacial surgeons do is basically you are a head and neck surgeon. You're a dentist, all right, but your duty is as a surgeon. So if people are coming with tumors in the face, people have had accidents, and it happens very often. Motorcycle accidents, they don't present a very good picture at all. The maxillofacial surgeon, one of your duties is to come in to help some sort of facial reconstruction for your patient. And we do that here. We do it all the time. We have patients coming in with broken faces. We piece them together and then plate it for them. So that's just one part. So just as you have a doctor who attends to children, there is a dentist who attends to children who is called a pedodontist. Like you have pediatrician, there's a pedodontist. Yes.
And how long does it take? How long does it take for one to specialize in any of these areas?
So up to the 8 years that I told you, in Ghana, our system requires that you do additional 2 years of a service to the community. So you either go into the district or you are in some polyclinic or hospital serving for another 2 years. After that 2 years, you become eligible to apply. So you write an exam, the primaries, and then you apply for a residency program. That's what we call it, to become a specialist. So from that 2 years point, it will take you 3 years to become a specialist. Then you do another 2 years to become a consultant.
So in all, it will take you about 5 to specialize.
Yes, to become a consultant. By consultant, it means that you can run a whole hospital on your own.
Okay.
Because you know everything there is to know about that area.
Okay.
Yes.
I would want you to talk about some of the challenges that students are likely to face when in entering the dentistry school.
Okay.
And I'll make you do that after the break.
All
Don't
right.
go anywhere. We'll be right back. Welcome back. If you just tuned in, you are watching the CGC show on AETV, and we have been discussing dentistry as a career. My guest, Dr. Tabi Amankwa-Mensah, has spoken about his experience and some of the entry requirements, and also how long, he talked about how long one would need to specialize in any of the areas in dentistry. I would want you to talk about how a student who probably failed one elective subject in high school would get a chance to go to the dentistry school.
Okay. So in our system, you need 3 electives.
Okay.
And then 3 core subjects. That's if you're going through the Ghanaian high school system. So usually you would need a very good physics background to become a dentist, because a lot of the things we do are based on physics principles.
Okay.
We do some calculations, not too much of it, but you need to know the properties of the materials you're using and stuff like that. So physics is very important to us. So if your physics is good, you have some elective maths and you're struggling with, say, biology and chemistry, you could replace one. But you would need a very good physics and math background.
Okay.
And then either chemistry or biology. So if you had challenges with biology, say you had B3, it is not the end of the road for you.
Okay.
If your chemistry, physics, elective maths, they are good, you could get admission into the program. Yeah.
Do you have working ethics pertaining to this particular career field?
A lot, actually. A lot. That's a whole discussion on its own. But at least the minimum, you're a doctor, you're supposed to be very professional with your clients.
Okay.
Our job we do is very intimate. So, for example, it may sound trivial, but you want to smell good. You've used some strong scented perfume. Now you're over your patients, and probably they're asthmatic. They start reacting to it. So when it comes to hygiene and presenting yourself, that is number 1. But the other ethics follow for all health professionals alike.
Okay. Yeah. Other softwares that you use, I know definitely you would definitely work with computers. So, in this modern day and the use of technology, I know you use a lot of computers. Are there specific computer programs that students will need to abreast themselves with before thinking of going to the job market?
Not necessarily.
Not necessarily.
Not necessarily, because most of the things that you need, you'll be equipped with while in school.
Okay.
And most of those manipulations will be done with your technician. We don't work independently.
Okay.
You work with your nurse, you work with your radiographer, you work with your lab technician. So you have a lot of people surrounding you.
Okay.
And let me be quick to add that in our line of work, if you probably presented to a dentist office and he has about 4 clients waiting, that's quite a queue.
Yeah.
As opposed to if you were going to see a medic and there were 4 people waiting, that's not a challenge at all, because it is more of consultation. You go, you talk. But we are called dental surgeons for a reason, because almost every job you do you would need some form of intervention. You need to do something for your patient. So sometimes it takes a while. And that is why you need to develop interpersonal relationship skills.
Okay.
You know, and it all comes down to you as a person. It's not just about knowing the material in the book. You need to learn person skills as well. Yeah.
Okay. I would want you to highlight some of the challenges that students are likely to encounter. You know, I mentioned one where probably students failed in subject, and you talked about that. So I want you to highlight some other challenges that students are likely to face.
A lot of people give up in their quest to become a dentist in Ghana.
Okay.
There are currently only 2 schools running the dental program in Ghana. University of Ghana and then KNUST.
Okay.
Other schools are trying to get accreditation to come on board. So it tells you that the slot is limited. It's very, very limited. My year group, for example, saw one of the largest graduating classes here in the University of Ghana, and we were about 27. Yeah, for the year.
And that's a lot.
And that's quite a number. Hitherto, they were doing about 15, 13, you know. So it's a very limited field. And everybody who understands or has had some experience knows that this is a good area that I must get into. So don't look down on yourself as a student, or don't give up. Because, yes, it will be challenging. But if 10 people are going to be picked, what prevents you from being part of the 10?
Okay.
The process in getting into the school, you would need to buy your forms when they come out, select the dentistry program, add your certificates and other things to it. When it gets to the selection part, there is an oral interview, there is a clinic lab session where you go and carve some model teeth for us to see your manual dexterity component as well. They don't hold on too much to that because you've not been trained, but just an idea. And then there is a written exam, or so you can get a spot.
Okay.
So it is not that easy, but it is not impossible because it is done, and there are plans to expand. So you shouldn't think about it that there's a limited area, only a few people are selected, so why waste my chance to apply? You can go ahead, apply, prepare, come in, and then you stand a very good chance of being selected.
Okay.
Yeah.
You are on the job market.
Yes.
Can you highlight some of the challenges that you encounter mostly on the job market?
In our setting,
Okay.
and this applies to all other areas of health, in our setting, people only present when their case is almost terminal or is late. In the sense that elsewhere, what we have seen is that people present early. The slightest toothache, they want to see their dentist. They feel like their teeth is not coming together, they want to see their dentist. So you have children, some as young as a year and a half, being taken to see the dentist. We will only see those children if they have cavities and it is paining them. So whenever they come to the dentist, it means that we would inflict some pain because we will need to intervene. And to them, it is a very painful process. So they don't come at all. And then in the adult population, they use all sorts of concoctions on the market. You'll be surprised what people do to their teeth. Some put petrol inside their teeth just to get the pain to subside. And let me put this out there. There is no traditional medication that works for tooth cavity. If you have a cavity, the only way is to see your dentist. It will dull down the pain, but it will come back because the infection is still ongoing. So our biggest headache, I would say, is the knowledge of the populace on what the scope of dentistry is. Because in simple terms, dentists remove teeth. But that is the least of the things we do.
Okay.
You see, people come for Botox from dentists. People come for veneers. They want their teeth to be white. White that is not from bleaching or so we fix smiles. People come with crooked teeth. We straighten them up. People come very extreme for dimples. And it's all done by dentists. People have tumors. They come, we remove, and you see their face, and they are unrecognizable. So the least of the things we do is managing your toothache or having to take out the tooth when it is really, really necessary. So for me, the biggest challenge out there is the knowledge on the scope of dentistry and the time patients present.
And I can tell for a fact that we have a lot of males or men in this particular career field. Why is it so?
Well, that fact may change now if you are looking at the statistics, because now there are more women than men in recent times. In my year group, there were more women than men in the year group. See. Dentistry is a very calm environment for ladies. And most of them also tend to have very good patient relationship. Even when they are inflicting pain, they are still caring about you. But most of the time, it will be like the guy, you're ready to just take out your tooth or do your procedure and go on to the next. But women have found it very comfortable because the working hours tend to be a bit more flexible. If you are not a surgeon, as a maxillofacial surgeon, your working hours is usually from 8 a.m. to about 3 p.m. Holidays are not included, weekends are not included. So it's flexible for women, and they are pursuing, and they are doing very well. The best student in my year group was a lady.
A lady?
Yes.
Wow.
The second best was probably a lady as well. And what were the guys doing? It has nothing to do with that. It tells you that it's a leveled ground. Whoever puts their foot forward can have it. Yeah.
But what if the lady has like some mood swings and is unable to attend to the customer?
You see, that is where the professional ethics come in. You have to leave your personal feelings at the doorstep and then focus on your patients.
Sometimes it shows, like without you knowing.
Yeah. You see, clients will come, especially for the ladies. It's a bit of a challenge. And I have had a few complaints from my colleagues, female colleagues. They will come and they are hitting on them. They are not interested in the treatment at that point. They just want to go out with you. So as part of the work ethics, if you think it will hinder your treatment plan and what you think you can do for the person, you refer. It's as simple. You just refer to one of your male colleagues, and then they take over from there. You see? So you don't put yourself in a tight spot. If it is uncomfortable, if you think the patient is non-compliant, you refer to a person who is higher or has more experience, and then the person will still be seen. You can't use your feelings to tell somebody that you're not going to receive treatment. It's unacceptable. Yes.
Okay. Now to specifics about yourself. How do you manage your time with regards to your work and your personal time with maybe family, friends, all of that? How do you manage it?
As I've mentioned earlier, as a dentist, it's quite flexible.
Yeah.
It's quite flexible. I am interested in surgery, so I tend to do a bit more. But generally, it's quite flexible. Monday was a holiday.
Yeah.
I was at home.
You were home? Oh, okay.
Yes. But if you're a medic,
yeah,
your duty may be on that time, and you have to go. We don't do nights. We don't do night shifts as dentists. If you're a surgeon and you are on call, as and when there is an emergency, you'll be called in. So it gives you enough time to be with your family, have hobbies. I'm learning how to play tennis. I have that time, and I'm still able to engage and be with my families. So it's not a challenge.
How do you handle emergencies too?
We have a system where our emergencies are graded, just like in any other area. So it's either they are presenting through the accident and emergency of the Kulebu Teaching Hospital, or maybe somebody is in very severe pain and goes to a polyclinic. There are contacts of dentists who are on call there. So they will be called in to assess. So if you know you are on call, you'll be around the vicinity, make sure your phone is on so that you respond. But that is mostly for the surgeons. For the general dentist, when you close, you're done.
You're done.
Yes, you're done for the day.
Aside all of these challenges, I believe there are some benefits. Like you said, you now have time to learn how to play tennis. What are some of the benefits of being a dentist?
The social status that comes with it,
Okay.
it's quite good. For those who don't know, they just don't know. But for those who know and have benefited from dentists, they really give you a lot of respect. And as it stands, there is a very good job security for a dentist in Ghana, because there are not too many of us. Even though the facilities are also not many, the population is growing. We are building hospitals day in, day out, and people need dental treatment. So it tells you that once government, as a policy, decides to add dental treatment to these hospitals that are coming up, it creates more room for dentists. So it affords you some job security, a stable source of income, and the luxury of time, which you can't take away. The job in itself is quite stressful. In previous times, dentists had one of the highest rates of suicide, and it was widely published. The job can be quite stressful because imagine you looking for a tiny space inside a tooth. The tooth itself is small, and you have to go into the tooth itself and make sure you work your way all the way to the bottom and then up. It can be stressful, and patients may not respond exactly how you want. And dental pain is a terrible pain. Nobody wants to experience that. So sometimes the kind of feedback your clients will give you, it brings some stress to it. But generally, it's a relaxed area. Yes.
There are some misconceptions I have here, and I would want you to either clear them or tell us the facts in it. They said there's no creativity in dentistry.
That's a tricky one, and I don't know why that somebody will make that statement that there is no creativity in dentistry.
They see it to be like pure science. It's just science. You are practicing. You are doing this. You are experimenting, doing this to get a result.
A fixed result. Okay. I started by saying that you need a bit of artistic skill and then dexterity to be able to be a dentist. Imagine somebody presents to you with a broken tooth and you have to build it up. You need to be creative. You need to reform it to conform to the person's face. If an elderly woman came in that, I've lost my tooth, I need replacement, you don't just go pick teeth randomly. You are looking at the facial profile. Is the person a woman, a man? The rest of the teeth, are they big, small? What's the color of the gum? A lot of things come in. So you as a person need to be able to picture the outcome even before you start. And that takes some creativity.
I see. And there's one that says that dental school is actually easier than medical school.
It's an outright lie. The medical students or any doctor who has been close to a dentist will tell you. When it comes to, this has been a subject of debate so many times, and it is widely accepted. When it comes to the training itself, dentistry is more difficult. But in terms of the work, how flexible it is, then dentistry is more relaxed.
Yes. The final one, and we are out of it, is someone says it is only those who do not get into medical school that become dentists.
They have a term. They say disappointed medical students. Yes. As it stands, is a no. Well, for me, it's not true. Because if I was getting into medicine, I was getting there with the sole purpose of going to a specialized field. I always wanted to be a surgeon, number one. Number two, something specialized that will give me some time off to do the things that I want.
Like. Okay.
A lot of ladies in my group did not choose medicine at all because they know exactly what you want. And because this is for students and prospective dentists, I have to put it out there that if you're working in the government sector, your salary and that of a medical doctor is the same.
Okay.
It's the same. Once you're on the same level, you receive the same salary because the training is the same. The basics is all the same. What differentiates a dentist and a doctor is the last 2 years of your training.
Okay.
And that is all. So everything you see for a general doctor, a medic, is the same for a dentist.
Okay.
And it's only those who don't understand that think that dentistry is lesser. So in University of Ghana system, you can't even choose medicine as your first choice and dentistry as a second.
Okay.
Or even nursing as your second. You have to choose one and go for it because we all see ourselves as independent professionals. Yeah.
Based on your experience in this industry, where do you think this career path will be in the next 5 to 10 years?
There is a huge market out there here in Ghana for dentistry. It's relatively young. It is growing.
Yeah.
So the private sector will boom.
Okay.
So I just have to position myself strategically to receive the wave and then ride along.
Yeah.
And that's exactly where I'm going. So I see it as a positive projectile. Yeah.
Your final words to people who would want to
I would just say that dentistry is a nice program. It is tedious as a student, but when you're done, it is very rewarding, very, very rewarding. So don't be afraid to take the bold step. Thank you.
Thank you so much for joining us today to discuss dentistry as a career. And thank you too for tuning in. You have been watching the CGC show and we discussed dentistry as a career. Our guest, Dr. Tabi Amankwa-Mensah, talked about some of the ways or processes you will need to go through to become a dentist, some of the challenges and also the benefits of being a dentist. If you have any questions, any suggestions, you can send them via social media platforms at AA_TV on Twitter, Association of African Universities on Facebook and YouTube, and at AATV Official on Instagram. Big thank you going out to GD Makeover GH for my makeup and, of course, Akosia Collections GH for my outfit. My name is Adjoa Omie, and I'll see you next time.